Hello, I'm Dr. James Wilson, and welcome to Senior Vitality Clinic. Today, I'm going to help you understand how to get the most out of every pharmacy visit so you can have better conversations with your healthcare team. This information is educational and should never replace personalized medical advice from your doctor. Here's something that might surprise you. According to the CDC, adults over 65 take an average of 4 or more prescription medications daily. That's a lot to keep track of. And here's what concerns me as a physician. Studies show that medication errors cause nearly 100,000 hospitalizations in older adults every year. Many of these could be prevented with simple questions at the pharmacy. Your pharmacist is one of the most accessible healthcare professionals you have. You don't need an appointment. You can ask questions when picking up medications. And they are medication experts who spend years studying how drugs work in your body. But here's the problem. Most people just grab their prescription bag and leave. They miss the chance to catch dangerous drug interactions, understand side effects, or learn money-saving options. Today, I'm going to give you 5 specific questions that pharmacists actually want you to ask. These aren't generic questions. These are the questions that can prevent problems, save you money, and help your medications work better. By the end of this video, you'll know exactly what to say at the pharmacy counter to protect your health. Let's get started. First, let me explain why this matters so much after age 60. As we age, our bodies process medications differently. Your liver doesn't break down drugs as quickly. Your kidneys don't filter things out as efficiently. You might have less body water, which affects how concentrated medications become in your system. According to the National Institute on Aging, these changes mean that side effects become more common and more serious after 60. Here's another factor. Many seniors see multiple doctors. Your primary care doctor might not know what your cardiologist prescribed last month. Your orthopedist might not know about your new diabetes medication. But your pharmacist sees everything you're taking if you use the same pharmacy. Let me address a common misconception. My doctor knows best, so I don't need to bother the pharmacist. Your doctor absolutely knows medicine. But pharmacists spend 4 years in pharmacy school studying specifically how drugs interact with each other and with foods. They study side effects, dosing adjustments, and safer alternatives. They are trained to catch problems your doctor might miss simply because they specialize in medications. Another misconception: pharmacists are too busy to answer my questions. Actually, patient counseling is part of their job. Federal law requires pharmacists to offer counseling on new prescriptions. They want to help you. When you ask questions, you're helping them do their job better. Here's why the pharmacy visit is so critical. Research from JAMA Internal Medicine shows that nearly 1 in 5 new prescriptions for older adults involves a potentially inappropriate medication, meaning a drug that might be risky for seniors. Your pharmacist can identify these issues if you ask the right questions. Think about this scenario. You're taking a blood thinner. Your doctor prescribes a new pain medication for your arthritis. Both drugs are fine on their own, but together, they could cause dangerous bleeding. Your doctor might not remember you're on the blood thinner if it was prescribed months ago. But your pharmacist's computer will flag the interaction if they take a moment to review it with you. Or consider this: you're taking medication for high blood pressure. Your doctor adds a decongestant for your cold. Decongestants can raise blood pressure. That's a problem. Your pharmacist can suggest safer alternatives for your congestion. I see this in my practice constantly. Patients come in with medication problems that could have been caught at the pharmacy. They are taking medications at the wrong times. They've stopped taking important drugs because of side effects they didn't understand. They are spending hundreds of dollars more than necessary because they didn't know about generic options. The pharmacy counter is your safety checkpoint. It's your chance to verify everything is correct before you start taking something. Once you're home and you've opened that bottle, it's harder to fix mistakes. Here's what I want you to remember. Your pharmacist is not just counting pills. They are checking every prescription against your other medications. They are watching for dangerous combinations. They are making sure doses are safe for your age and kidney function. But they can only help if you engage with them. Now, let's talk about the 5 questions you should ask at every pharmacy visit. Question 1. What is this medication supposed to do for me, and how will I know it's working? This might seem basic, but it's critical. According to a study in the Annals of Pharmacotherapy, up to 50% of seniors don't fully understand what their medications are for. If you don't know what a drug is supposed to do, how will you know if it's working? How will you know if you're having a problem? Let me give you an example. Say your doctor prescribes a statin for cholesterol. You need to understand, this drug lowers cholesterol to reduce your risk of heart attack and stroke. You won't feel anything when you take it. That's important because some people stop taking it, thinking it's not doing anything. But it is working, you just can't feel it. The only way to know it's working is through blood tests. Compare that to a blood pressure medication. You might feel dizzy if your blood pressure drops too low. That's a sign something needs adjusting. But you need to know this is possible so you can report it to your doctor. When you ask this question, the pharmacist should tell you times the specific condition being treated, times how long before you should see results, times whether you'll feel the effect or need tests to monitor it, times what improvement looks like. Here's the follow-up question. What should I do if I don't see improvement? Maybe the dose needs adjusting. Maybe you need a different medication. But you need to know the timeline and what to watch for. Always talk to your doctor before stopping or changing any medication based on this information. Question 2. Can you check my medication list for interactions, including my over-the-counter drugs and supplements? This is huge. The American Geriatrics Society publishes something called the Beers Criteria, a list of medications that are potentially risky for older adults. But most patients don't know about it. Here's what happens. You're taking prescription medications from your doctor. But you're also taking vitamin D, calcium, fish oil, maybe some herbal supplements from the health food store. You use over-the-counter allergy medicine. You take aspirin for your heart. That's a lot of different substances going into your body. Some combinations are dangerous. St. John's wort, a popular supplement for mood, can interfere with blood thinners, heart medications, and antidepressants. Calcium supplements can block absorption of thyroid medication if taken at the same time. NSAIDs like ibuprofen can increase bleeding risk when combined with blood thinners. When you ask this question, bring everything you take, prescription, over-the-counter, vitamins, and supplements. Some pharmacies can scan your bottles. Others will create a list. This takes a few extra minutes, but it could save your life. The pharmacist should check for times drug-drug interactions, medications affecting each other, times drug-food interactions, like grapefruit juice with certain drugs, times drug-disease interactions, medications that worsen existing conditions, times duplicate therapy, taking 2 drugs that do the same thing. A study in JAMA found that nearly 20% of seniors are taking medications that could interact dangerously. Your pharmacist's computer system can flag these problems instantly. Here's a real example from my practice. A patient was taking both prescription omeprazole for acid reflux and over-the-counter Prilosec, which is also omeprazole. That's double the intended dose, because she didn't realize they were the same drug. Her pharmacist caught this during a medication review. Remember, always consult your doctor before stopping any medication, even if the pharmacist identifies a concern. Question 3. How and when should I take this medication for the best results? Timing matters more than most people realize. According to the Journal of Clinical Pharmacy and Therapeutics, taking medications at the wrong time can reduce their effectiveness by 30% or more. Some medications work best on an empty stomach. Some need food to prevent stomach upset or improve absorption. Some should be taken in the morning because they can cause insomnia. Others should be taken at night because they cause drowsiness. When you ask this question, the pharmacist should tell you, for timing, time, specific time of day, morning, afternoon, evening, bedtime. Times whether to take with food or on an empty stomach. Times what empty stomach means, usually 1 hour before or 2 hours after eating. Times whether to space it away from other medications. Times if you can take it with your other medications or need to separate them. For method, times can you crush the pill or open the capsule if you have trouble swallowing. Many can't be crushed safely. Times should you take it with water, milk, or something else. Times any specific instructions like shake well or refrigerate. Here's an example. Levothyroxine for thyroid should be taken on an empty stomach 30 to 60 minutes before breakfast and separated from calcium, iron, and some other medications by at least 4 hours. If you take it with breakfast or with your calcium supplement, you might only absorb half the dose. That's a big difference. Another example. Some blood pressure medications work better if taken at bedtime rather than in the morning. This can improve how well they control your blood pressure overnight. Some antibiotics need to be taken at specific intervals, like every 8 hours, to maintain consistent levels in your blood. 3 times a day is not the same as every 8 hours. Every 8 hours means you need to set an alarm, even at night. Your pharmacist can also tell you what to do if you miss a dose. For some medications, you take it as soon as you remember. For others, you skip it and wait for the next scheduled dose. This varies by medication, and it's important to know. Before making any changes to how you take your medications, based on this discussion, talk to your doctor. Question 4. What side effects should I watch for, and which ones mean I should call my doctor right away? Every medication has potential side effects. The goal isn't to scare you, it's to prepare you. Research from the American Journal of Medicine shows that patients who know what to expect are more likely to continue taking necessary medications and less likely to panic over minor, expected effects. There are 2 types of side effects: common but manageable ones and rare but serious ones. Common side effects might be annoying, but usually aren't dangerous. Times mild nausea, times dry mouth, times flight drowsiness, times mild headache. Serious side effects that require immediate medical attention might include times difficulty breathing, times severe rash or swelling, times chest pain, times confusion or changes in thinking, times severe dizziness or fainting, times unusual bleeding or bruising. When you ask about side effects, the pharmacist should distinguish between these 2 categories. You need to know, is this normal and will it go away, versus do I need to stop this medication and call the doctor immediately? Here's an example. If you start a statin for cholesterol, mild muscle aches are fairly common and often resolve in a few weeks. But severe muscle pain, especially with dark urine, could indicate a rare but serious condition called rhabdomyolysis. That's an emergency. You need to know the difference. Another example. Starting a new blood pressure medication might cause mild dizziness for the first few days as your body adjusts. That's usually manageable. Move slowly when standing up. Stay hydrated. But severe dizziness with falls, or feeling like you might pass out, that's a sign the dose is too high. Call your doctor. Ask the pharmacist, what symptoms mean I should stop taking this and call my doctor immediately? Get specific answers. Write them down. Also ask, how long might side effects last? Sometimes you need to give a medication 2 to 3 weeks for side effects to improve. Other times, side effects mean the drug isn't right for you. Important: never stop a medication suddenly without talking to your doctor, even if you think you're having side effects. Some medications must be stopped gradually. Question 5. Is there a less expensive option that would work just as well? Medication costs are a real concern for seniors. A study in JAMA Network Open found that nearly 1 in 4 seniors skip doses or don't fill prescriptions because of cost. But there are often less expensive options that work just as well. When you ask this question, the pharmacist can check for generic versions. Generic drugs have the same active ingredient as brand-name drugs. The FDA requires them to work the same way in your body. They cost 30 to 80% less. If your doctor prescribed a brand name, ask if a generic is available. Therapeutic alternatives. These are different medications that treat the same condition. If your doctor prescribed an expensive drug, there might be an older, less expensive drug that works similarly. The pharmacist can call your doctor to suggest alternatives. Different quantities. Sometimes a 90-day supply costs less per pill than a 30-day supply. Or sometimes a higher strength pill that you split in half costs less than 2 lower strength pills. Only split pills if your pharmacist says it's safe. Many can't be split. Discount programs. Many pharmacies have discount clubs. Drug manufacturers often have patient assistance programs. Good RX and similar services can find lower prices. Your pharmacist knows about these options. Different pharmacies. Prices vary widely between pharmacies. Your pharmacist might suggest checking prices at other pharmacies or using mail order for maintenance medications. Here's a real example. Atorvastatin, generic Lipitor, costs about $15 to $30 per month at most pharmacies. But with a discount card or warehouse club pharmacy, it might be $4 to $10 per month. That's $120 to $300 per year in savings for one medication. Another example, if you're prescribed Nexium for acid reflux at $300 per month, the generic Omeprazole might be $10 per month and work just as well for most people. That's $3,480 per year in savings. The pharmacist can't change your prescription without your doctor's approval. But they can contact your doctor to discuss less expensive options. Give them permission to do this. Never sacrifice necessary medications because of cost. If you're having trouble affording medications, tell your pharmacist. They can help find solutions. Your health is worth it. Before switching to a different medication to save money, make sure your doctor approves the change. Now, let me give you specific action steps you can take at your next pharmacy visit. Before you go to the pharmacy, make a list of all medications and supplements you currently take. Include times prescription medications times over-the-counter medications, pain relievers, antacids, allergy medicine, times vitamins and supplements. Times herbal products times even things you take occasionally. Write down the dose and how often you take each one. If you're not sure, bring the bottles. At the pharmacy counter, don't be rushed. If the pharmacy is busy, that's okay. You can say, I have some questions about this medication. When would be a good time to speak with the pharmacist? They might ask you to wait a few minutes or come back at a less busy time. Ask the 5 questions we discussed. 1. What is this medication supposed to do for me, and how will I know it's working? 2. Can you check my medication list for interactions? 3. How and when should I take this for best results? 4. What side effects should I watch for, and which ones mean I should call my doctor? 5. Is there a less expensive option that would work just as well? Take notes. Your pharmacy might give you a printout of important information. Keep it with your medication. Questions to ask your doctor at your next appointment. Times: are all of my current medications still necessary? Times: are the doses still appropriate for my age and kidney function? Times: I'm having trouble affording my medications. Can we look at less expensive alternatives? Times: my pharmacist mentioned a potential drug interaction. Can we discuss this? Create a medication management system. Use a pill organizer if you take multiple medications. Fill it once per week. Set phone alarms for medications that need to be taken at specific times. Keep a medication card in your wallet with your current medications listed. Update it when anything changes. Use the same pharmacy for all your prescriptions if possible. This helps the pharmacist track everything you're taking. Resources. Times Medicare Part D offers prescription drug coverage. If you don't have it, look into enrollment. Times State Pharmaceutical Assistance Programs, SBAPs, help with medication costs in many states. Times RxAssist.org and NeedMeds.org list patient assistance programs. Times the Medicare.gov Plan Finder can help you compare prescription drug plans. When to follow up. If you experience new symptoms after starting a medication, call your doctor's office. Don't wait for your next appointment. If side effects are making life difficult, don't suffer in silence. There might be alternatives that work better for you. If you're missing doses because of cost, confusion about instructions, or side effects, address this with your healthcare team right away. Remember, your pharmacist and doctor are partners in your care. They want you to ask questions. Your active participation makes their job easier and keeps you safer. Let's recap the 5 questions your pharmacist wants you to ask. 1. What is this medication supposed to do, and how will I know it's working? 2. Can you check for interactions with all my medications and supplements? 3. How and when should I take this for best results? 4. What side effects should I watch for, and which require immediate medical attention? 5. Is there a less expensive option that works just as well? These 5 questions can prevent medication errors, save you money, and help your medications work better. They take just a few minutes, but can make a significant difference in your health and safety. Remember, every person is different, and what works for one person may not be right for another. Always discuss any changes to your health routine with your doctor before making them. This video provides education, not personal medical advice. Your healthcare team knows your specific situation best. Your pharmacist is an important member of your healthcare team. Use them. They are trained experts who are there to help you stay healthy and safe. If you found this helpful, subscribe to Senior Vitality Clinic for more evidence-based health education. Next week, we'll discuss how to prepare for your annual Medicare wellness visit. Thank you for watching, and here's to your health.